I mean, it's so amazing. The Dallas County Commissioners, and I'll bet you our kids are just like, oh, yeah, that's right. Yeah, that was a good move. Dallas County Commissioners just declared racism a public health crisis. I'm sorry, what? Wait. Racism is a health issue now? In fact, not just an issue, it's a crisis. Oh, well, if they passed it, that must mean racism is a health crisis. Nobody's ever died, well, unless people get violent about it, but nobody ever dies from just word racism. I mean, it might hurt somebody's feelings. No, you don't die from it. You can't get sick from it. What do you mean it's a public health crisis? It's a behavior. It's an ugly behavior that humans have and share with each other. It's not a health issue. It is a behavior. However, the resolution that was presented by longtime Commissioner John Wiley Price addresses 10 points meant to tackle racism in Dallas County.
Oh, this is going to be rich.
Number one, assert that racism is a public health crisis affecting our entire county.
So we assert that?
Yeah, we're asserting it.
Okay, we're asserting it.
Number two, we're going to work to progress as an equity and justice-oriented organization with the Commissioner's Court and its staff leadership continuing to identify specific activities to further enhance diversity and to ensure anti-racism principles across Commissioner's Court leadership, staffing, and contracting.
So help me. That's a run-on sentence.
Sure is.
So we're asserting and progressing. Got it. Okay.
We're also, number three, promoting equity through all policies approved by the Commissioner's Court and enhance educational efforts aimed at understanding, addressing, and dismantling racism and how it affects the delivery of human and social services, economic development, and public safety. Another run-on sentence.
Seriously, man. Someone get this guy a gerund.
Number four, continue to advocate locally and through the National Association of Counties for relevant policies that improve health in black communities and support local, state, regional, and federal initiatives.
Blah, blah.
Number five,
blah,
further
blah, blah.
work to solidify alliances and partnerships with other organizations that are confronting racism and encourage other local, state, regional, and national entities to recognize racism as a public health crisis. You still haven't gotten any of the medical system involved here. So if it's a health issue, why is there no medicine involved?
Yeah, we're halfway home. And
okay, I'm up to number 6. I've not heard anything about the medical community, doctors, nurses, prescriptions, drugs. What can we take? This is unreal. Number 6, support community efforts to amplify issues of racism and engage actively and authentically with communities of color wherever they live. Now, what does that even mean? You support to amplify issues of racism and engage actively and authentically. Shut up. Number 7, to always promote and support policies that prioritize the health of all people, especially people of color, by mitigating exposure to adverse childhood experiences. Number 8, institute racial equality training with the goal of reaching Commissioner's Court agency leadership and staff. Number 9, encourage racial equity training among all community partners. And number 10, identify clear goals and objectives, including periodic reports to the Commissioner's Court to assess progress and capitalize on opportunities to further advance racial equity. Not a single word in a public health crisis, by the way. Public health crisis about doctors being involved, health professionals of any kind being involved, and no medication involved. Not even mental health people are involved
You missed
here.
number 11. Get prescriptions for racists, and if you take it, then you're cured. Is that
I wish. No, that's not there. That's not
number
there.
10 is update us regularly on our brainwashing efforts.
Yeah. I mean, so ridiculous.
This is
It's so ridiculous. So out of control.